Everyone's sun smart today? No, yeah. You're in the shade, We'll just see if Denny... Do you want to come stand with me? Okay. Okay. My son Daniel. Yeah, very good. Today he wants to be a lifesaver too. Hey, there you go. All right, you ready to go? Yeah, you don't touch those though. Okay. All right. Good morning everyone, and what a great Queensland sunny day, and isn't it great to see so many people here enjoying the Queensland freedoms. There are only other states now that have come online to enjoy some of the freedoms that we're enjoying and have been enjoying, and we'll continue to be able to enjoy those freedoms because Queenslanders are stepping up and getting vaccinated. And we've got a great partnership which is launching today where you can be a lifesaver yourself and get a jab. We're partnering with Surf Lifesaving Queensland to deliver vaccination clinics right here at beaches from Coolangatta all the way up to the north, all the way up to Cairns. Isn't this fantastic? Great partnership with Surf Lifesaving Queensland, and can I commend the Surf Lifesavers, can I commend Queensland Fire and Emergency Services and Queensland Health for bringing this together. So the challenge for Queenslanders is be a lifesaver, get a jab. Be like our lifesavers who are on the front line protecting us and keeping us safe. By getting vaccinated, you can keep your fellow Queenslander safe. By getting vaccinated, you can keep you and your family and your friends safe as well. So we're encouraging everyone out there, step up, get vaccinated. We're on the way to opening the borders, which will mean that COVID will come into the state. So the more people that are vaccinated, the more people are protected against COVID-19. Happy to also provide the updates around the COVID numbers overnight. So 0 new cases. That's 0 local cases, 0 overseas acquired cases, and 0 cases detected in hotel quarantine. We've only got 13 active COVID cases in Queensland at the moment. Over the last 24 hours, we've had 7,400 tests, and good numbers, 14,312 people were vaccinated by Queensland Health. That doesn't include people who've been vaccinated at their local pharmacy or with their local GP, but 14,312 vaccinated by Queensland Health. And across our theme parks and other tourism venues yesterday, we had around 200 people vaccinated, which is fantastic. It brings the total number of first doses to 77%. So we're getting there. We're up at 77% first doses, fully vaccinated 63.05%. Interesting numbers as well. 2.5 million vaccines have been delivered so far by Queensland Health, and right across Queensland with our partnerships with pharmacies and GPs, a total number of 6.1 million vaccines have been delivered. But we need more. There are still people out there who are not yet vaccinated. So now is the time to get vaccinated. This is the weekend, vaccination weekend. Got to get out there, got to get vaccinated. There's many, many places to be vaccinated. Go to your local beach. Surf Lifesaving clubs are offering vaccination clinics. Go to your local pharmacy, to your GP, to the theme park, and also our Queensland Health mass vaccination clinics. It's really important for people to step up now. You are running out of time. This is the last weekend for you to get your first dose so that you are fully vaccinated by the time the borders open. Step up now, get vaccinated. It's time to be a lifesaver and get a jab. Now I invite some of my great friends here. I'll firstly invite the Deputy Chief Health Officer to say a few words, and then we'll hear from Commissioner Leach and Deputy Commissioner Steve Golcheski, and also Ken from Surf Lifesaving.
Well, thank you very much, Minister, and morning everyone. And as the Minister said already, some good news. We have had 0 overnight cases, both in hotel and locally acquired cases, so that's some really good news. I guess the messaging today is similar to what it's been in recent weeks. It's about vaccination and really emphasising the critical importance of people getting vaccinated if they haven't done so already. So as we move towards opening the borders and reuniting families, that comes with it the expectation that we will have coronavirus coming into Queensland. So it is imminent. People must be vaccinated. The levels of protection that we have and the ability that we have to manage coronavirus in the community is down to contact tracing, which is a constrained and limited capacity. It's down to societal restrictions, and it's down to vaccination. And the greater the levels of vaccination coverage that we can achieve in the community, the less of the other things that we need to do, and in particular the less of the societal restrictions. So it is critically important, and we encourage you to come forward if you haven't done so already. So as the Minister said, there's a number of different pop-ups and other facilities available this weekend. So we have, I believe, 6 theme parks that are offering vaccination, as well as 23 surf clubs and 29 other pop-up vaccination locations. So Queensland Health is doing as much as it possibly can to make vaccination accessible for people, and to limit any barriers that people might have to coming and getting jabbed. So if you haven't done so already, we strongly encourage you to come forward this weekend. Thank you.
So good morning. As you've heard, the vaccination rates continue to rise in Queensland. It's very important for everyone to remember that this is our way out of the pandemic. We're working very hard at the moment to work out how we can properly operationalise at 70, 80 and 90%, and that we're very confident that we're going to get there on the timeframes that we've seen. We're also doing the work at the moment evaluating our home quarantine system that we've had in recently, the trial, and looking at expanding that in the future. Whilst no decisions have been made around that, it's very important that the Queensland community does what it's done all the way through the pandemic. All the way through the pandemic, we've seen only 7 deaths in this state. We've seen only just over 2,000 infections because our community has listened to us, taken the advice and done what we've asked of them. Now we're asking you to get vaccinated. That is the thing that we need to happen across all of this state. We're seeing here today people coming here to get vaccinated. We saw at Aussie World and Australia Zoo yesterday people getting vaccinated. That's going to continue to happen, so please do that. But in the interim, please remember, we're not at 70% overall yet, double vaccinated, nor are we getting any closer to 80% until December. So in the interim, you must carry your mask and you must wear it when you need to. You must make sure that you abide by the Chief Health Officer's directions. If we have an outbreak now, it can still have devastating impacts. We need you to keep working with us. So please, we're all looking forward to the end of this. We can see the end line in sight. Let's keep getting vaccinated and get there as quickly as possible. Thank you.
Can you go first?
Good morning. As you've heard, it's important that we get vaccinated, and we're very happy at Surf Lifesaving to partner with the Queensland Government in this initiative to open up our surf clubs as vaccination clinics for this weekend. You can tell by the number of people on the beaches this weekend already that the temperature's starting to get up there, and we would love it that people can safely come to our beaches. They are a big community hub, and that's why we've been happy to partner up. And so I just emphasise that message for this weekend: be a lifesaver and get a jab. Thank you.
Good morning, everyone. The Bureau of Meteorology has issued a severe thunderstorm warning for southeast Queensland for today. So there's potential for severe thunderstorm cells to form across southeast Queensland, with the potential for heavy rainfall and hailstones. So we encourage people, if you're out and about in southeast Queensland today, take the opportunity to clean up around your home, maybe park your car under cover this afternoon, and keep an eye on the weather radar for any storms that are in your area. It's really important that you clean up around your property and you're ready for whatever the weather might bring today.
Questions? James?
When that border opens on December 17, we won't see any more zero case days. How many cases can we expect to see in that initial period from December 17?
Look, it's really hard to calculate, and it's very dependent on who comes in, what the seeding events actually are. We do expect that we will see seeding events, so by that I mean people coming in with coronavirus that set off smaller outbreaks. Those outbreaks will become more difficult to control when there's more outbreaks than we've had previously. So in the past we've had small numbers of cases that we've been able to very intensively manage. That'll become more and more difficult as we get more cases. So we will anticipate that it will become endemic or spread within the community probably before the end of this year.
Can we expect to see hundreds of cases a day?
Eventually, I'd expect to see hundreds of cases a day. I'm not sure I'd see them, and I am using a bit of a crystal ball here. I'm not sure we'd see that before the end of the year, but certainly into next year we would, yeah.
In terms of contact tracing, does that sort of fall by the wayside at a certain point when there's so many cases that we just won't do contact tracing anymore?
No, it'll never fall completely by the wayside, but the intensity of it will reduce, right? So at the moment we're following up with people very intensely, looking at, their bank transactions, CCTV, really trying to pinpoint exactly where they've been at what time. That's not going to be possible. It won't also be as necessary when we get more and more cases, because the aim will be to reduce the burden of disease in the community and to substantially reduce the likelihood that it'll spread from one person, but there will be cases and transmission events that'll slip between the gaps, and that's what we'll see as we move forward and as we get more and more cases in the community.
Why this weekend is so critical? Is it because the next few weeks obviously for the jam take effect when the borders open? Can you explain that?
Yeah, so look, it's hard to say exactly how long it is before you get completely protected, but it's anywhere up to 2 weeks after your second jab is where you'll have maximal protection. So we'd say that at least a week after your second jab is where you're really starting to hit your straps and to be protected. That's why it's so important for people to get vaccinated sooner rather than later, so that they actually have full levels of protection when they're likely to be exposed to coronavirus in coming months.
Deputy Commissioner, yesterday the Deputy Premier announced that 90% will see that borders, the hard barrier torn down. Could you be able to give us a little bit of insight into how the Christmas crowds will work this year? Will there be an express lane for people, a sticker available for double vax to come through, or do you have to check their test results at the border?
Yep. Look, we're working on all that at the moment. Look, it's been really made clear by government that we're going to keep the borders in place till 90%. So the sooner we can get to 90% better, first thing. Second thing, what we're trying to do, of course, is look at what the flows of traffic are going to be like. So we're doing some work at the moment, including with TMR, to anticipate as we open up what sort of flows can we get across the border. Our aim then is to get it across as efficiently as possible, given the number of people we have lined up, but make sure that we can do the level of checking we need to do against what the risk is at the time.
Do you anticipate that you'll get crowds that you've never seen before? We know your officers can handle it, but you would be anticipating you'll get crowds that you've never seen before?
Yeah, look, we're around 20,000 vehicles per day getting intercepted now. We expect that to be more than double. So that's a fairly significant increase. Look, I've got confidence we'll get through it, but can I just say this for our community? Every time we've done this, it's been pretty untidy, pretty lumpy. It's going to change. We will see delays. We will work through that, and we'll continue to improve it as we go along.
And what would be your very stern message, I guess, to the unvaccinated, that people they can come in?
Well, the unvaccinated are the problem at the moment. If people can get themselves vaccinated, we'll do this quicker, and we'll get to 90% quicker, and as soon as we hit 90%, the borders are gone.
But
so that's where we're going.
Try.
Of course they'll try. They've tried all the way through, and we've been pretty good at catching them out, and we'll continue to do that. Look, you've only got to look at the overall numbers in Queensland. Just over 2,000 infections and only 7 deaths. Like, compared to everyone else, we've done pretty well.
Are you looking forward for the day, though, that the barriers come down? It must be, on a policing, being that you're in senior police, for operational senses, it must...
There's a really simple answer to that, yes.
Just on that express lane thing as well, will you be checking every single car for the vaccine?
Look, at the moment our posture is up to 100% compliance checking depending on the environment. We have to do in a safe way, not only for our members but also for the community, so we factor that all into it. As I said, our approach has been highly effective in making sure that we keep COVID out of Queensland, and that's what we're going to continue to do.
Have you interviewed Duran, not you, but have police interviewed Duran?
No, not yet. We're waiting for him to be cleared, so he's still in hospital, so as soon as he is we'll be able to interview him.
Do we have an update on his condition? Is that man on the gold post? Duran?
I don't have any specific... No, he's not in ICU. I haven't been given an update recently, which indicates
So
his condition.
I can say he has agreed to speak to us, so as soon as we're able to, we'll be doing that. Thank you.
Minister, just again, I guess from a policing point of view and those borders on that 90%, from a government point of view, 90%, it looks very difficult for us to get to 90%. We might be talking March, April next year. Do you think that it's, in terms of tourism and viability, Qantas is talking about bypassing Queensland now because they don't have confidence in 90%?
Yeah. Well, Queenslanders have always stepped up. Throughout the entire COVID pandemic, Queenslanders have stepped up. They've followed the health advice. They've kept their fellow Queenslanders safe. And we're asking them again to step up and get vaccinated. And 77% of them have got that first dose, and more are getting them every single day. So the sooner we get to 90%, the sooner we can enjoy even more freedoms than we're enjoying at the moment. And the people of Queensland expect that the government will continue to keep them safe when it comes to COVID-19. So having those postures around the border until we meet certain levels of vaccination is important. That's what the people of Queensland want us to do.
Do you foresee that it'll be at 90% when we open up, or do you think the Premier may concede and go a little bit earlier, considering that the rest of the country will be open up at that 80% threshold?
Well, everything we've done has been based on the expert health and medical advice. So we've based our plan around reuniting families on that health and medical advice. We've made it very public, and those dates are dates based around when we predict when people will reach those certain percentages. But if people roll up their sleeves and get vaccinated sooner, then we can make decisions around opening up sooner.
Minister, are we getting closer to finding a permanent chief health officer?
Oh, look, I understand the Deputy Premier discussed this yesterday. There's a number of things to look at. There's obviously a number of people who applied previously. Those people may be considered for the role, but also it's up to the selection panel as to whether or not they want to go out to market again. But we've got some very talented people in Queensland Health. You just heard from one of them, one of our Deputy Chief Health Officers. We're in very safe hands, and I've got every confidence that we'll continue to get the expert medical and health advice that we need to navigate the pandemic. Oh, well, you'd have to ask him if he wanted to apply, but look, we've got some great people. And I'm sure whoever we get as our Chief Health Officer will continue in the tradition of Jeanette Young in being not only a great advisor to government on health matters, but someone who the people of Queensland trust.
Before we ask Dr. Smith about his career aspirations, just on the 90%, what date does the current modelling show that we'll get there? We know you've got dates for 70 and 80, so at the current rate, what date will we get to 90%?
Yeah, well, it does depend on how many Queenslanders step up and get vaccinated. I know the Deputy Commissioner for Vaccinations mentioned that he expected it will be early next year, and there's a lot of variables. But he said that he would be expecting it early next year. I hope it's sooner than that. And there's many opportunities this weekend for people to get vaccinated. So the faster people get vaccinated, the faster we hit 90%.
Could I just ask if anybody in the public that wants to engage in anti-Semitic behaviour, your comments around that?
Well, it's not the Queensland way, is it? Queenslanders are renowned for being hospitable, tolerant and understanding of one another, and they deplore anyone who wishes to engage in racist behaviour. So anything like that I condemn in the strongest terms, and I know all Queenslanders will as well.
Minister, Qantas has delayed international flights from Queensland until as late as February. Is Queensland being left behind because of quarantine rules that don't fit 90%?
Well, Queenslanders have backed in the expert health advice which has kept us safe. There are rules around when people are coming to Queensland and coming to Australia, whether they need to be quarantining or not. The roadmap is very, very public. People who are vaccinated will be able to come back at 80% and home quarantine. So the roadmap is very, very clear. Those people who want to engage in international travel, you can by encouraging your Queenslanders to get vaccinated and get up to 90%.
Just one more. When will the government release more details about living with the virus? Like, for example, will people still need to go into isolation when they're close contacts? Like, will schools continue to shut down if there's cases there? And businesses have to keep shutting down?
Yeah, well, we've made it clear with our plan to reunite Queenslanders around the restrictions. It's actually on the bottom of the plan, so it's not a secret. There's information right there around quarantine periods, exclusion zones, business support, restrictions, home quarantine. It's on the website. It's very, very public. People can have a look at that. That's the plan moving forward. But of course, if more Queenslanders get vaccinated faster, then we can open up sooner.
Dr. Smith, would you be keen to put your hand up to be the Chief Health Officer?
Oh, look, so I didn't have my hat in the ring the first time, and I know that the Director General's looking at how to progress this as quickly as possible and what sort of process they'll use. So once I found out about that, I'll consider my options.
Why is this such a special moment for surf lifesaving to be able to contribute to the vaccination?
We have a great partnership with the Queensland Government, and we do consider our surf clubs as the public domain. The community own it. We have 35,000 or plus members around the state who are all volunteers, and I guess our mantra is we want people to be safe at our beaches. So in any way, if we can help, then this is part of that. We have 23 clubs ranging from Cairns or in Port Douglas right down through to Coolangatta.
Are surf lifesavers actually administering the jabs, or is it Queensland?
We would never ask surf lifesavers to administer an injection. All credit to the health departments right throughout the state. They've managed to get these people on weekends. I think Bunnings last weekend 100 schools. I don't know where they got the medical staff for that. And this weekend, medical staff stepping up and spending their weekends giving the jab. I think it's amazing.
They become honorary surf lifesavers?
Anyone who gets a jab's a lifesaver.
What's your first and last name, just for the camera?
My name is Ken Clark. I'm the general manager, also a volunteer down on the Gold Coast, actually. So,
Clark with an E or just
no, Ian Clark, one of the poor ones.
I mean, I reckon it might also, open people's eyes up to what surf lifesavers do. It's a bit of a promotional thing too.
Look, it's not so much the promotional thing, anything we can do to help the Queensland Government with this. Obviously, I believe it's Tourism Week this week, am I right? So tourism's a big thing with our lifesavers, and we'd love to see people come to our beaches. That's what we do, and the safer it is, the better. So I would encourage anyone who does come to the beach, yes, get a jab, but when you go for a swim, always swim between the red and yellow flags.
Minister, could I just ask, we just talked about tourism, how beautiful our beaches are.
Yeah.
If Qantas does bypass Queensland because it can't get a guarantee from the government on when it opens up,
Yeah.
does that say for tourism? People want to come to our beautiful beaches, but we're at 90%, and how come that 90% wasn't discussed in the roadmap out?
Yeah, well, the 90% is discussed, and the deputy.
It was discussed yesterday, in fairness. The Deputy Premier came out and said it right at the end of the press conference.
Well, the 90% was also mentioned a couple of days ago when you and I were at a press conference with Deputy Commissioner Shalepi around when he expected 90% to be hit. We can hit it earlier, but at the end of the day, we're still taking the expert health and medical advice on this. Queenslanders have been kept safe. Queenslanders are alive today because Queenslanders have stepped up and listened to that expert health and medical advice. We'll continue to do that. There is a roadmap ahead. It's public. People can have a look at that, and as soon as we get more people vaccinated, then we can open up even more.
Minister, in all due respect, yes, the government's kept Queenslanders safe, but the flip side of the coin is tourism's dying.
Well, I dispute that. Look behind me. You've got all these Queenslanders here at the beach enjoying a wonderful Queensland sunny day. There's people out and about all over the state. It's been something that we've been able to enjoy for the most part of the COVID-19 pandemic because we have had a strong health response. So we have been able to keep the state open. We have been able to support businesses because we've had a strong health response, and we are enjoying freedoms today. You see it behind me right now, that many parts of the world are not enjoying today.
Will the state government be asking the ADF to stay on to amend the protocol?
We're in constant work and dialogue with the ADF. They've been with us all the way through, and I anticipate they'll be with us until the end. If not at road borders, certainly at our hotel quarantine and those types of issues. And also we have a severe weather season upon us, and every year the Australian Defence Force stands up with us and helps defend our community when things go wrong with bad weather. So look, there's no issues there. They're with us until Christmas with the road borders, and we'll look at that at the end and have more dialogue with them.
Just talking like previously about the express lanes that might be an option. Like why can't police just do as they've done previously rather than keep the disruptive and unpopular checkpoints?
Look, we do a combination of all of that right now. So we do random checks as well as checkpoints. So there will be road borders in place until 90%, as the Premier has indicated. So how we do that operationally is something that we'll work through depending on what's happening at the time. Thank you.
Thanks everyone. Thank you. Let's go. Everyone vaccinated? All right. Excellent. Thank you. Thank you. Very good. Thanks, James. Yeah, thank you.